again for your learning pleasure. So we are really blessed to have multiple amazing presenters today. The first is Sarah DeWeese, who is our Senior Director of Research Policy and Asset Building Programs with our great partner organizations, First Nations Development Institute. She's going to give us all a sense of the native VITA field and direct us to numerous support resources for you all. Then we are excited that Maureen Hagbloom, Director of Impact with the United Way Anchorage, and Chris Ashley, Senior Tax Consultant with the IRS, are going to share with you the best practice that they have learned from their Financial Prosperity Coalition in Anchorage, Alaska, where they run a VITA program that heavily relies on partnerships to increase outreach. Lastly, Roxy Keynes, Earned Income Credit Campaign Director with the Center on Budget and Policy Priorities, is going to give us some helpful information on the Affordable Care Act and help us think through how that legislation will affect native VITA programs. I think you will get plenty of great ideas from all of these wonderful speakers. Also on the line with me today is our webinar master technician from VITA, Stephanie Fishing-Hawk. So she'll be helping me answer questions, so you might get the opportunity to hear her lovely voice as well. Before we get too far into it, I would like to get an idea of what stage you would currently describe your VITA program as being in. So we're going to go ahead and launch a poll. And a poll is going to come up, and it's going to ask you how long you have served with the VITA program. Okay. The results are starting to come in. It looks like we kind of have people from all over the board here. Great. Good to know. Okay, we're going to close this poll and show you the results. But we actually have 33% of you are not currently a VITA site. So that's great to know, because we will really try to make sure that we give you a good sense of how VITA works and what's possible to do using a VITA site. And we're sharing those results now, but you should also see that some of you have been doing this a long time. So we have some 22% of you have been doing this 2 to 5 years, 28% 5 to 10 years, and then 17% have been doing it for more than 10 years. So we kind of have a great spectrum of people today, and that's really exciting because it will give us a good sense of all the different things that are possible with the VITA program. So now I'm going to turn it over to Sarah DeWeese, who is going to give you the VITA basics and a good sense of what is happening with native VITA programs throughout the entire country.
Thank you, Crystal. Hello, everybody. As Crystal said, I'm Sarah DeWeese with First Nations Development Institute. We're a sister organization to First Nations OISTA Corporation, and we share the mission of building healthy Native economies and have a long history of working in partnership with First Nations OISTA Corporation to support asset building in Native communities, including supporting volunteer income tax assistance sites. And I'm personally very passionate about this topic and have done a lot of research on this topic. And so I'm happy to be here today to talk to you a little bit about the native VITA field and kind of give you some context for your work. So as you see on the slide in front of you, the native VITA field is very large. There's 146 VITA sites serving Native communities. And of course, it's growing. Well, it's grown a lot since 2009. I've worked closely with Patsy Schramm, who is the former IRS spec rep. Those of you who have been doing this work for a while know that spec stands for Stakeholder Partnerships, Education, and Communication. So that's one of those bureaucratic offices in the IRS, but a very important office that does a lot of outreach and helps people start their VITA programs. So I want to credit Carol Quiller, who is the new IRS spec representative supporting work in Native communities. And she did share data with us in 2013 and 2014. So what you're seeing here is, I think, a very large field, but also a growing field. So the next slide, we always get the question, okay, great, it's a big field, but who's actually doing VITA? And I think this is a really important slide because hopefully you guys will see yourself there. There's a lot of Native CFIs doing, or community development financial institutions doing VITA. A lot of tribal housing authorities as well. A few tribal colleges, unfortunately that's gone down. A lot of Native nonprofits. But when we look at our data set, what we find is that a lot of tribal governments are directly sponsoring VITA sites. And to me, that really speaks to the value they see in VITA and the recognition that VITA, volunteer income tax assistance, can bring back a lot of money in the local community. So that a lot of tribal governments very directly sponsor these programs. But another thing I just want to mention about this chart is that you'll see that actually a lot of the VITA sites serving Native communities are not necessarily run by Native nonprofits or tribal programs. So that's something we have to keep in mind. But going on to the next slide, I think it's really important to celebrate our successes. And as you can see here, the number of tax returns prepared has gone up a lot over time. And last year, and so that last bar is from tax prep season 2014, which is tax returns from 2013. But anyway, over 51,000 returns prepared. And this is my favorite number. So just in EITC alone, earned income tax credit alone, over 27 million, almost 28 million brought into these communities. And again, that has increased over time. So I think let's all give ourselves a pat on the back, because that's a really, really noteworthy number, significant number, and a lot to be proud of there. So next, I'm going to quickly tell you about some other research we've conducted on Native VITA sites, and these publications hopefully will be of use to you, especially those of you who maybe are just starting out. In 2013, we did issue a publication. It's got a very straightforward title, VITA Sites Serving Native Communities, the State of the Field. And so this does have some data analysis in it, similar to what you just saw. But also, to be honest, we actually wrote this publication for funders in addition to practitioners. So it was really to tell the story of what is unique about VITA in Native communities. And so our research really helped us understand some things that we feel are different, and maybe sometimes are advantages and sometimes are more challenging in Native communities. So we encourage you to check out that publication. Just some of our findings were, again, many of these communities are very rural and the population is very spread out. So there are some Native VITA sites that are using very creative solutions, like doing tax preparation over Skype, which I believe is called remote, what is that called? It's a sort of strategy for remote tax preparation. Another really important finding is that, as you know, in many Native communities, people receive per capita payments or minors trust payments. And so what we learned is that those folks working in the VITA sites do have to get certified at a different level, at the intermediate level, so they can prepare the tax form, or they can process a 1099 miscellaneous income. So that would be another example of just some kind of unique issues that may face Native VITA sites. And then finally, we also produced a publication in 2013 that was written by Sarah Hernandez, Patsy Schramm, and myself, that talks about some best practices for Native VITA sites, and also what I think is exciting, a lot of new innovations. So that might be facilitated self-assistance is really growing as a way to help people learn to prepare their own taxes. And by the way, in 2014, there were over 25 facilitated self-assistance sites serving Native communities. You're seeing virtual VITA, as I mentioned. Virtual VITA uses Skype to prepare taxes. You're also seeing VITA sites link benefit screening. So when people come in to have their taxes prepared, they're also screened for different types of benefits, and sometimes signed up for benefits that they may not have known that they were available to them. And then finally, you're also seeing links to asset building services. So people are using their EITC refunds and sometimes their tax refunds to either open an IDA account or open a savings account. So again, we encourage you, the next slide will tell you where you can download this. It's on our website, firstnations.org, and you would click on Knowledge Center and then follow those links. And I know Crystal's planning to send some of it out. I believe one of those publications is too large to send out, so she'll just send a link to it. But again, well, thank you for the chance to talk to you this afternoon, and look forward to the future discussion.
Thank you so much, Sarah. So as Sarah mentioned, you will receive copies of pretty much everything that we're going to reference today throughout the webinar. So before we get to some of our other panelists, does anybody have any questions for Sarah? If you would like to ask a question, go ahead. You can raise your hand, and we will take you off mute. Or we will also, you feel free to use the chat or question feature box. We're going to give you about a minute here. Sort of think through all the great things you could potentially ask Sarah.
Hopefully I can answer the question.
Okay. Well, I think you were just too good, Sarah. Oh. Okay. So next, the Anchorage Financial Prosperity Coalition is going to discuss their VITA work. And they're just a really great case study for what VITA can do and what it can bring to their community. And they're going to talk about how they've leveraged partnerships to increase and improve outreach for their VITA programs. So Maureen and Chris, are you there?
We are here, and we even remembered to unmute.
Great. All right, well, take it away.
All righty. So, hello, everyone. As Crystal said, I'm Maureen Hagblom, and I work for United Way of Anchorage. And what we plan to focus on today is the power of partnering and relationships and how those components shape the work here in Anchorage related to financial prosperity. So what you see there on that first slide is a little bit about the work that United Way of Anchorage is involved in. So I thought I'd give you a quick view of that and why we're involved in that work. So the impact area that I happen to direct revolves around a community goal of low-income Anchorage residents being housed and financially stable. That is what my world holds first and foremost in everything that we do. So we work on a variety of strategies that will help have the greatest impact on that community goal. So there at the bottom of the slide, at the crisis level, we work to help improve service systems. So an example of that real quick would be the creation of an emergency sheltering system here in Anchorage, and we only did that with the help of many, many partners. And that was to ensure that families with children were sheltered even when family shelters are full during the coldest winter months. And yes, we do have that situation here in Anchorage where our family shelters are full during the winter. And we did at one time have a situation with families and children not having shelter. So that was a system improvement that we were able to make with the help, like I said, of many partners. So then at the next level, we're very much about increasing community resources to help families remain housed. So an example of that is our Anchorage Walk for Warmth event that you see noted there on the slide, and we raise, which help raises utility and rent assistance funds for the community, which is a very much lacking in our community, and of course can be the reason why families become unsheltered. So then that brings us then up to that third block on the slide. A large portion of our work is about financial stability and building assets. So an example of that, of course, is the work of the network of partners that assist with free tax preparation, financial education, workshops, events, and programs that support all of that work. And that, of course, is the work I'll be talking about today. And noted there at the top of the slide, we're also involved in leading an affordable housing initiative that's called Housing Anchorage, and that's all about strategies to decrease the number of people that are burdened by housing costs. So that's just a little bit about all of the work, and I believe my slide will advance. Yes, it just did. Fabulous. Okay. So so slide 2 is what we're really talking about there is some of the history that's related to tax preparation in Anchorage. The folks that do the most tax returns here in Anchorage is AARP Tax Aid, and they've always completed the greatest portion of tax returns here in Anchorage for free. VITA has also been involved as well, and we also have tax preparers that actually work in the tax preparation field that volunteer their time for other events. So TaxAid has been providing the service in Anchorage since 1995. United Way became more involved in 2003, and our focus was to help TaxAid help more taxpayers. About 2010, and trust me, after a few attempts, we didn't come out of the blocks with this component working perfectly. But in 2010, United Way convened a group of partners that in the end all agreed that their organizations had a vested interest in helping Anchorage households increase their income and save for the future. So that's the group of partners that really make a lot of our financial stability work happen. So in the end, last year for tax year 2013, we did increase the returns that were filed in Anchorage to over 4,200 returns, again with the help of many folks. So what the system looks like today, there are 10 tax sites that offer face-to-face assistance, and we have several self-assisted sites that have computers available. That's the myfreetaxes.com option, which also offers a 1-800 number, chat, and email assistance. Alaska 211, which is a direct service that is offered by United Way of Anchorage, they do provide the connection to statewide tax site information and hours and days of operation, because there's a lot going on outside of Anchorage as well. We do also host several additional income boosting services. We have 3 Super Saturday events that are held during tax season, and so that is in addition to tax preparation being offered at those events. And then we typically offer a Procrastinators Day on April 15th, and that's where volunteers come out and help until late into the evening hours for those procrastinators that didn't get their taxes done. I'm just advancing here. Okay, so what we have found in the last few years is to make all of this happen, a lot of relationships needed to be nurtured and partnerships needed to grow. You know, we found that partners really have an easier time helping each other and working toward a common goal when projects are offered to work on together. So talked a little bit about some of those, but a few examples there on the slide are Super Saturdays. So about 15 to 20 providers come out for those events. It gives them all an opportunity to get to know each other better, and it also gives them an opportunity to reach more of the people they would like to serve. We've recently, the last 3 years, started partnering with the Better Business Bureau on an annual financial fitness fair, and that has proven to be very successful. Better Business Bureau offers a shredding service and a secure your ID sort of focus. And then our partners then go ahead and host the financial fitness fair, which offers workshops throughout the day. And other providers are there to help, and bankers are there to help people with other sort of financial services. Alaska Saves is a savings campaign that we've just recently started working on, and we plan to launch the end of January next year. So that is a very cool savings campaign, and that will help people understand the value of saving. And the partners also work very closely together on volunteer recruitment for tax preparation volunteers. That is a huge effort, and we're getting ready to wrap that up. We start that in late summer, early fall, and we are working together on volunteer recruitment, usually through the beginning of December, right about now, because training starts on December 18th. And then, of course, the partners all help each other with outreach to taxpayers. So all of the events require a work group of partners to work together that meet regularly and make all of this happen. So that's when people really get to know each other well. And it seems I may have lost control. Oh, it just got it back to advance my slides. Yeah. Oh, there we go. Okay. So the next couple slides, I'm going to turn it over to Chris, and she's going to talk to you about another example of what happens when partners work together.
Yeah, we just wanted to give you an example of just some of the synergy that happens once you do start with or to work with organizations that you might not automatically think of. One of the things that we've done for the last 2 years is all the AARP sites in Alaska, as well as several of our VITA partners statewide, provide food stamp referrals to tax clients if it looks like their income meets the requirements. What we do is we've added information to the prep use form in TaxWise, and for those of you who have existing VITA sites, this will look familiar to you. But we added the income limits for, the first 5 family sizes so that the tax volunteer can see at a glance whether the taxpayer's AGI looks like they will fit within the income guidelines for the SNAP program. If so, then the tax volunteer just mentions the food program and offers a flyer so that the taxpayer can reach out and get more information and be screened for food stamps. The reason we started doing this was because the AARP state coordinator happened to just chat with the food stamp outreach coordinator at one of our Super Saturday events. During our normal course of events, until we all started working together on these projects, the tax aid coordinator would probably never have had any interaction with the food stamp coordinator. So we started by simply having the food stamp coordinator came and did outreach from time to time at some of the tax sites, but they agreed that many tax site clients, appeared to be eligible for the food stamp program and probably didn't know about it. So by having this conversation, they came up with this fairly easy way for the tax volunteers to recognize when people might need information about the food stamp program without having to learn a whole new program or a whole new set of requirements. So all that they do is hand out the flyer, and then the taxpayers are free to reach out and contact the food stamp program and be totally screened. The food bank is really happy with this outcome because they've had an increase in referrals, and they can tell from the locations that they're getting the referrals from that at least some of them are a direct result of our volunteer tax outreach. And the volunteers like it because they're giving useful information, but they didn't have to learn a whole new set of rules on top of learning tax law. And it's worked out very well for us. In Anchorage alone last year, we gave about 20% of our tax clients a flyer. 762 clients were referred to the food bank. We have other volunteer partners that participate in this program as well. Tlingit-Haida Regional Housing Association in Juneau and our Alaska Business Development Center partner who offers VITA services in really remote locations all around the state, they participate in this program too. And so that's bringing the information sometimes to very small, remote, rural Alaska villages where the food stamp would never have a chance to have an outreach coordinator visit there. And so it's just another way to get information into the hands of the taxpayers. So everybody's just been really pleased with the way that that cooperation works, and it's led to some other interactions between agencies as well.
Okay, and Crystal, it seems like I've lost control of the slide capability, so I will need you to advance it to the next slide if possible. Alrighty. So a little bit more about what we found to hold, what holds the group of partners together and what helps attract new partners. Yes, having a strong partner willing to take on a leadership role is important, and yes, United Way does tend to lead a lot of those efforts, but we can only do that with the help from others because there's only one person here at United Way to do this. So it's very important that we're able to recruit other partners that are just as interested in the work and are just as passionate about it. So I do have someone that helps with launching the Alaska Saves effort that I talked about. And as you heard Chris talking about, she very much is the leader about the technical aspects of tax preparation, of course. So wouldn't happen without all of that. So, and then partners do step in and lead components of projects. For instance, on the Super Saturdays, Chris is very instrumental in pulling together the providers for those Super Saturdays. You know, when you're working with 15 to 20 providers that need tables and electrical and outlets and Wi-Fi, that can be a job in itself. So Chris very much helps with that. That's an example of you know, leading different components of projects. Partners, it's important that, you know, we found that they don't feel a lot of pressure, that they can contribute what they are able to contribute. So that always seems to work super well. And it's important that all the partners can see an advantage to their constituents by participating. So you know, example of that was that financial fitness fair I talked about. Better Business Bureau really saw the advantage of partnering on that Shred Day financial fitness fair, and the providers that are at the financial fitness fair are able to broaden their reach and learn from other providers and all of that great stuff. The core groups, the work groups that meet, and the Financial Partnership Network, we found it's really important that we're very consistent with those monthly get-togethers. So there can be times where the group getting together, you know, you don't have all the players in the room, but we move forward with who we have, and then there's times when we have more players than we thought possible. So just having that consistency is important. And also important that partners are able to learn more about the work of others and promote their work as well as their own. So we get a lot of, oh, wow, I didn't know your agency offered that service. And I love that when that happens. We also, as part of our network meetings, we will have other agencies present their work and talk about their work too, and that helps, again, the community of partners get to know each other better there too.
Okay, and just another example of how working together like this has helped us achieve our mission of getting information out to our tax clients and also to the clients of our other partner organizations is, you know, the Affordable Care Act and the tax aspects of it are an important item for us this year. And by working together as a group, we've been able to get some information out to a lot of clients of our partner organizations that otherwise they might not have realized the impact of it. For instance, the people who might need to apply to the marketplace for an exemption, by talking about that in our coalition meetings, then some of the different organizations realized that they might have some clients who had experienced homelessness or otherwise were going to need to approach the marketplace now and claim their exemption before they were ready to do their tax return. And so we can get some of those preemptive things out there and get the information out there when people really need it and not at the last minute.
Okay, and then if I could have the next slide, please, that would be great. Alrighty, so as far as the partnerships go, you know, we've been asked, well, is there a binding document? No, not really, but sort of. So basically what's happened is the partners have all agreed to a set of guiding principles which are listed there on the slide. And probably the most important message that I'd love to get out there about, you know, the guiding principles is that although everyone that comes to the table works for an organization that has its own distinct mission and own program criteria and their own funders that have criteria, there are still community issues that affect clients of those organizations that organization cannot improve on alone. So that's the beauty of having that network of partners and sort of that collective that comes together on some of those issues that that we know are affecting clients, but we're not able to fix them by ourselves. So the very important piece of this too is that those organizations do share program info and data as much as they are able. There's a one-page summary of the collective group of the entire network of partners that will be sent out with your reference materials, and there's a lot of data in there, and that's how we capture it. All the partners are willing to share it, and that's super, super important. If we can go ahead and advance to the next slide, that would be great. And then there's continuous improvement. So what we do to make sure that we are always looking to offer the best services to those that we serve is we do survey most of the taxpayers, or the taxpayers that are willing, and it does turn out to be a very high percentage. We want to know how they heard about us. We'd like to collect information to get to know them better so we know what services would help them the most. Our workshop attendees are surveyed to find out if the workshop was valuable, what would make the workshop more valuable. And we love to find out how the workshop attendee plans to use the information that they learned. That's always very valuable. And then the providers at the events are also polled on their opinions as to how to improve events and reach more people. We get a lot of good feedback from our providers. After all events, the partners that are involved in the work groups, they debrief. We develop lessons learned and ideas for the next activity or event, and we're very good at that reporting and very good at going back to that reporting when we're planning the next event to see, what we liked or didn't like about the event the previous year. And then partners are always looking at what additional system improvements, services, and events will help more Anchorage residents, of course, increase their income and save for the future, because that's their focus, and they use data to do that. And then we're always looking at what other communities are doing. So the first Financial Fitness Fair came about by looking at what another community had accomplished with a similar event, and that's how the idea grew here in Anchorage. And now we have other communities in Alaska that are also looking at doing financial fitness fairs, and there was one just offered in October in Fairbanks that was very, very successful. So basically, related to continuous improvement, data drives action, and data drives the next steps, and that's pretty much how we roll. So I believe I am done with this section of the presentation, and if there's any questions, we'd be happy to answer those.
Great. Thank you so much, Maureen and Chris. I loved the idea of the procrastination day. That made us laugh here. So does anyone have any questions for Maureen and Chris? While we're waiting for those to come in, I just wanted to add that I know that some of you are probably from more rural areas, such as a larger city like Anchorage. So just let me assure you that there is totally possible to leverage partnerships like this in rural locations as well, or for smaller VITA programs and kind of this more this really amazing comprehensive program that they have. So at our VITA site, for example, we had South Dakota State law students come, and they would volunteer as tax preparers. We worked with our housing authority to encourage individuals who were behind in rent to catch up with that using their tax refunds. We received tons of referrals from other tribal programs. And we would host our Super Saturdays. We did an event similar to that with our Boys and Girls Club and in their Boys and Girls Club facilities. And so we even managed to train our volunteers doing shared training sessions with the Lakota Funds, which was actually another CDFI located on the Pine Ridge Reservation, get together once a year for shared trainings. So there are a lot of ways to use partnerships like this to make VITA program more cost-effective for you or more possible. And I think that you guys just did such a great job articulating what was possible through using those partnerships. So does anyone have any last questions? We haven't had any come in, but you guys are welcome to raise your hand or put one in the box. Okay. All right. Well, I guess you guys were super comprehensive as well. Yeah, we're going to go ahead and have Roxy Keynes with the Center on Budget and Policy Priorities give us a brief introduction to the Affordable Care Act and give us a sense of how this new law could affect Native VITA sites. So Roxy, are you there?
I am. Thank you so much. So good afternoon, everyone. We are going to jump right in this brief overview of the Affordable Care Act. And so let's see. Okay. So The Affordable Care Act. What is the Affordable Care Act? It was signed into law on March 23rd of 2010, and it expands access to health insurance for those who are uninsured and provides a requirement for most people to have health coverage. For the first time, taxpayers will have to report health coverage or lack of coverage of family members in 2014. There's an opportunity to claim exemptions from the coverage requirement. You heard a little bit about that earlier, and I'll share a little bit more later. And there's also a calculated penalty owed for any months without coverage. And when we file our tax returns next year for 2014, there is a process to reconcile any advance payments of premium tax credits received during the year to help pay health insurance premiums. So we're going to see new questions on the 1040 tax return, and there's also some new tax forms that I'll share a little bit about later as well. All of these items are in scope for basic VITA volunteers. So for those of you who are planning your trainings or recruiting volunteers, know that this will be something that all volunteers will have an opportunity to learn and be able to serve clients. So there are a few provisions of the ACA that specifically impact American Indians and Alaska Natives. First, it included permanent reauthorization of the Indian Healthcare Improvement Act. It also allows for continued use of Indian health services. It provides an opportunity to purchase health insurance through marketplaces and enroll in Medicaid, Medicare, and CHIP throughout the year. So this throughout the year provision is specific for, in general, there are specific open enrollment periods, and then some people may qualify for a special enrollment period. But this provision allows for enrollment throughout the year, and also enrollment can take place for people who are eligible for Indian health services as well. And the ACA also restricts out-of-pocket costs. So for Native Americans with incomes below 300% of the federal poverty line, they're exempt from out-of-pocket costs such as coinsurance, copays, and deductibles. And for individuals with higher incomes, there's a limited cost sharing. There's a limit for cost sharing for use of non-IHS health services. So the Affordable Care Act has expanded health insurance through two primary ways. We have the Medicaid expansion, which now allows people with incomes up to 138% of the federal poverty line to enroll in Medicaid, and states have had the opportunity to decide whether or not they will expand. We're going to take a closer look at Medicaid a little bit later on. And then we also have the health insurance marketplace. So the federal health insurance marketplace is where if someone enrolls in the marketplace for health coverage, they're eligible for premium tax credits. And these premium tax credits are available to people with incomes between 100 and 400% of the poverty line. It's estimated that 28.6 million people are eligible, and during our open enrollment period last year in 2013 for 2014, the open enrollment period overlapped from the end of 2013 to earlier this year. There were about 28% of people who were eligible actually enrolled. So that's a pretty good enrollment rate, especially taking into consideration the technical glitches and difficulties that took place. And so now there's another open enrollment period, and there's an opportunity for more people to get coverage as well. So of those that enrolled, 85% received financial assistance. And the average exchange subsidy will be $7,900 by 2023. So this is a benefit. The premium tax credits provide great financial assistance for those who are uninsured. So now let's take a look at a few key concepts related to the Affordable Care Act. First, we have minimum essential coverage, or MEC. So what is minimum essential coverage? So again, there's this new requirement to have health insurance that qualifies as minimum essential coverage and to actually report it on the tax return. So in general, most types of health insurance will count as minimum essential coverage. And MEC means that if you have coverage for one day in a month, then you're counted as being covered for that entire month. So if somebody actually had coverage for part of the month, let's say they had coverage now up until this day, and then next week they lost their health coverage, they would still be considered as having MEC for the month of December. So I want to go back to the idea of having minimum essential coverage as a requirement. Earlier I mentioned that it's a requirement that most people have this coverage. And there are some exemptions. So one is exemptions based on Indian tribal affiliation. Members of federally recognized Indian tribes are not required to have minimum essential coverage. They can opt out of this requirement. And there are two ways to do that. One is on the actual tax form, tax return. When filing a tax return, you can file for this exemption, which would be code E. And there's also an exemption available through the marketplace. And we'll take a closer look at the exemptions a little bit later. I just wanted to mention these now so that you can think about this as we move through the rest of the information. So there's also an exemption for if someone is an American Indian, Alaska Native, spouse or dependent of either who is eligible for services through the Indian Health Services. And those same exemptions would apply. So you can get it through the tax return or through the marketplace. There's also exemptions based on religion. If someone's a member of a healthcare sharing ministry or a member of certain religious sects, then they also can opt out of this requirement to have minimum essential coverage. Okay, so this is a chart that shows what counts as minimum essential coverage. On the left-hand side, this is what does qualify, and on the right-hand side is what does not qualify. So looking at the left-hand side, you can see that most health coverage plans do qualify as minimum essential coverage. On the right-hand side, I want to point out that Indian healthcare providers, services through Indian healthcare providers, does not count as minimum essential coverage. Also, certain limited benefit health coverage programs would not count. So if someone does not file for one of those exemptions, if they're eligible and they only have one of these options on the right, then they may have to pay a penalty. So the exemptions help to avoid penalties, and we're going to talk a little bit about that shortly. So the premium tax credit, I shared a little bit about it earlier and want to just share a little bit more about what are premium tax credits. So we've gone over some of this information already. It's important to note, again, that you have the federal marketplace, and then there are some states that have their own marketplaces. And the same rules apply for both of these. So when you hear the term marketplace, it's referring to either or, and that includes the exemptions that are available as well. So for most people, insurance can be purchased only during open enrollment, and there's currently an open enrollment period now. It started November 15th and goes to February 15th of 2015. Also, there are special enrollment periods as well that may allow someone to enroll in health insurance, and that could include a life change such as having a child or relocating, for example. So members of federally recognized tribes and Alaska Native Claims Settlement Act shareholders can enroll in marketplace coverage any time of the year and can change plans up to once a month. So this also is a special provision. Okay, so there are 4 primary criteria to be eligible to claim premium tax credits. First is that one must be enrolled in a marketplace plan. So if someone receives health insurance through their employer or through another from another source, then they are not eligible for premium tax credits. And if they are eligible for health insurance from another source and they decide to turn it down because they want to enroll in the marketplace, they would not be eligible for premium tax credits if there is that offer of health insurance from another source, as long as that health insurance meets HHS's definition of affordability, then one would not be eligible for the premium tax credit. Next is that one must have income between 100 and 400% of the federal poverty line, which we talked about a little bit earlier. Here you can see what that range is. The federal poverty line is a new level is established each year, so this is for 2014. There is an exception that lawfully present immigrants with income under the poverty line are eligible for premium tax credits if they are ineligible for Medicaid because of their immigration status. And that would generally be because they've been in the U.S. for less than 5 years. So what counts as income when we're talking about having income within 100 and 400% of the federal poverty line? Well, income in this case is considered modified adjusted gross income. And here's a chart that shows you what is counted in modified adjusted gross income. So it includes AGI, non-taxable Social Security benefits, tax-exempt interest, and excluded foreign income. And this chart shows you the lines on the tax form that correspond with each of these categories. So this chart is a snapshot of what is not included, what is not counted towards modified adjusted gross income. This comes from the Consumer Assistance Resource Guide for American Indians and Alaska Natives, and I included a link to that for you so you can take a closer look at it. So the other criteria to receive premium tax credits. Number 3 is that you must have an eligible filing and dependent status. So like the earned income tax credit, you cannot receive premium tax credits if you are married filing separately. You also cannot be a dependent if you are going to claim the premium tax credits. And lastly, you must be ineligible for minimum essential coverage, as I mentioned earlier. And as a reminder, any services through IHS do not count as minimum essential coverage. So now let's take a look at Medicaid. So with the Medicaid expansion, it's primarily adults, including parents, whether they're working or not, and adults without dependent children that are the newly eligible based on the Medicaid expansion. And the Medicaid expansion is what 138% of the poverty line. You can see what that looks like on this chart here. And again, states had the choice to decide whether or not to expand. Anyone can enroll in Medicaid at any time of the year. And here you'll see 138% of the poverty line, where earlier I referenced 133%. And that's because there's a portion of income that is not counted. So the effective limit is 138%. So, okay, let's see here. Okay, so this is a chart showing the status of states that have decided to expand Medicaid. So in case you are not sure, you can see where you fall, where your state is, and whether or not that applies to you. So now we'll take a closer look at exemptions. So this is what we looked at earlier, the exemptions that are available based on Indian tribal affiliation. And what else do you need to know? Well, for these exemptions, I mentioned you can get it through the tax return when you file a tax return, and there's a tax form where you would put in that code E, or you can get it through the marketplace. Exemptions through the marketplace do require tribal membership verification. And so there's an application that you would submit for that exemption, and that requires verification of additional documents such as a tribal enrollment card or a tribal census document, for example. And different states can help identify what are the documents that are acceptable. When you apply for the exemption at tax time, you do not need to submit these documents. And in general, applying for exemptions at tax time through the IRS is a simpler process than filing through the marketplace. Many of the exemptions are available in both places. There are a few that are available only through the marketplace. And there are some resources later on that will help you find which ones are which. So these two exemptions are permanent. So once one goes through the process of claiming it, then you don't have to do it year after year after year. If at any point one becomes ineligible, then they must notify the IRS. Let's see. Okay, can we go next? Looks like, oh, here we go. I think I have it now. Okay, so another thing to know is that claiming an exemption does not prevent individuals from enrolling in coverage through a marketplace. So you can do both. And there are other exemptions available, as we heard a little earlier. So if someone isn't eligible for any of these exemptions, they should be screened for another hardship exemption. And you can find a list of all of the different exemptions available through this link. So the ACA at VITA site, just to recap a little bit, there are now new steps when filing tax returns. So first, you'll want to know, did everyone on the tax return have health coverage all year? If they did, then you will check a box on the tax form, line 61. If they didn't, then you'll go to the next step, which is to see, is anyone on the tax return eligible for an exemption from the coverage requirement for any month during the year? So can the exemption be taken on the tax form, or does it require marketplace approval? So if someone is not eligible for an exemption, then you may have to calculate an individual shared responsibility payment using a tax worksheet. And if someone on the tax return purchased coverage in the marketplace and qualifies for a premium tax credit, then you will complete Form 8962 to go ahead and reconcile any advance payments of the credit with the remaining credit. So the individual shared responsibility payment is one more thing that I just want to go over with you. So this chart shows the maximum that payment or the penalty could actually be. It does increase each year. So in the event that you're working with someone and they do not qualify for an exemption, you can see how much a payment may actually be on this chart. Now, it's important to note that there are caps for each of these as well. So here are just a few resources for you. There's some ACA resources and links at the top that are available through IRS. The slide is a little cut off here, but IRS has a page dedicated to the ACA, and so you can find a lot of updates there as well. The Center on Budget and Policy Priorities has resources. The first link is to two links that are specifically for Native American communities. So one of the links is to that chart that I showed earlier of income that does not count towards minimum essential coverage. Also, there's a webinar series specifically for tax preparers through our Health Reform Beyond the Basics.org website. So I highly recommend that if you are preparing taxes, running a VITA site, if you'll be training volunteers, you can use the materials there to help prepare your volunteers. And then the Federal Marketplace has a link as well with more info. And lastly, I want to share another resource since you are involved with free tax preparation. The center also runs an Earned Income Tax Credit Outreach campaign through eitcoutreach.org. And at this website, you'll find different outreach materials, Earned Income Credit Estimator to see how much a potential credit could be worth. There's a link to Native American resources and outreach strategies, among many other resources as well. Thank you.
Great. Thank you so much, Roxy. We are so excited about all that information. I'm especially excited about the resources because even as we were sitting here, we were like coming up with questions, and so seems very, very potentially complicated, and so having those extra resources I think are going to be really useful. We are having a couple questions come through, so we are going to take, for example, Diana has a question, and we are going to take her off mute. Diana, would you like to pose your question?
Yes, I was wondering if there's a requirement in order to claim Code E. I mean, are we going to, I mean, like if you apply for it in the marketplace, you have to provide a census card. Are they not going to require anything when you file your tax return?
I didn't hear the question clearly. Is there a requirement for what?
In order to claim in order to put Code E on your tax return.
Okay. Is there a requirement? Is any documentation needed if you're putting Code E on your tax return?
Yeah.
Okay. To my knowledge, there is not at this time. In general, if it's not a tax form, the IRS doesn't ask for documentation initially when someone's filing a tax return. If they have questions about something, then they may ask someone to provide documentation later on. I'm not sure if one of the other panelists can say any more about that question.
No, that's really a good answer. You know, you know, like many other things at a volunteer site, the taxpayer may have some documentation, but there's not a requirement that you prove that you have, you know, you don't have to bring in your insurance card. We just need, the volunteers need to be sure that they've gotten enough information that they know that, you know, that the taxpayer understands the question and that they are, you know, are getting an accurate answer. But it's just like everything else on the tax return, you know, the ultimate responsibility is the taxpayer to be correct, and the volunteer isn't there to audit the return. They're just there to do a good job on doing the return.
All right. It looks like we have one additional question. I think it would be Saniva. I think I'm pronouncing that correctly. I hope I am. We're going to take you off mute if you would like to go ahead and pose your question.
Okay, I was wondering, those resources that she shared regarding the ACA, would we have like an opportunity to write them down again? Because I couldn't keep up or copy those sites that she listed.
Great question. I am going to, in the follow-up email that you receive, you will receive a copy of this PowerPoint presentation.
Oh, perfect.
Oh, and I think all the links will also be active for you from there. So hope you can either copy them down or they will be able to automatically link pull them up. So.
Okay, thank you.
Okay, well, we are going to go ahead, and I just wanted to let you guys know that we just have a couple resources that are available for all you great native VITA sites out there. We really did I'm excited about our new VITA marketing materials that we have coming out for Native communities. You can see here on these slides, we really tried to make them look fresh and new this year, but we have paycheck stuffers that would, you know, potentially you could have if you worked with a tribal program, have go into all of your checks that would go out for paychecks. We have little business cards that you can print your information on the back. We actually, new this year, we have some volunteer recruitment posters, and then we have, you know, just your basic marketing signs for around your community. And those are designed to, you know, obviously we can't use the graphics that work with every single community, but are designed specifically to appeal to a lot of our Native communities. And so we're excited about those, and those will be part of the packet that you will receive in outreach. And then I do know that we had some people that are looking into VITA sites that are new this year, and so I wanted to make sure my clicker is misbehaving. Okay, we have some guides that we're also sending out. They're a little dated, I'm not going to lie. They're actually from 2005, but they are kind of basically, we have one for community members, a consumer workbook to use, as well as a tribal leader's guide to launching an EITC campaign, which basically will walk you through how to set up a VITA site. So we're excited about that. And I just wanted to let you know that we are so thankful for you all. We are going to, have we had any additional questions come through that we need to see answered? I think it looks like they were all answered. Okay, great. If you have any additional questions that come through, or if you think of anything later, please feel free to reach out to me, and I will be glad to answer them for you, and be glad to serve as a resource for you or help you find the information that you need to track down. Thank you so much for our fantastic speakers. You will receive an email from us that will have a link to a quick survey to ask how this webinar was. We always are trying to improve our quality of our services. So, you know, please take the time. It's just 5 questions to answer those for us. And this actually, I just want to take a minute to celebrate, concludes our 2014 monthly webinar series. So we look forward to launching yet another great 2015 webinar series. If you have any ideas for topics or things that you would really like to see us cover as part of that, please let me know, and I will make sure we take requests. So please feel free to reach out to us and let us know if you have anything you'd specifically like to see covered. Did we get all of our questions? Okay. Well, great. Thank you all so much, and we will look forward to seeing you in January of 2015.